Hey guys, Frank Curzio here. As you know, I've been covering the coronavirus for over 2 months, trying to stay ahead of this in terms of a stock market perspective and economic perspective. And I want to give you a quick update because I just interviewed someone that's truly amazing. His name is Chad Nielsen, and he is Director of Accreditation and Infection and Prevention at the University of Florida. And that's the health department. That's a fancy way of saying that he's one of the leading infectious prevention doctors, right? So I just interviewed him on a Wall Street Unplugged podcast, and I asked him. I said, "Take me through the whole process. What happens if I come in and I don't feel good and I have symptoms? What's the next step?" Uh, you know, he was talking about isolation rooms and how you're testing and things like that. But he took me through the whole entire process, and it's kind of amazing because they are not testing for the coronavirus right now. They really aren't. So, I mean, the current tests, he even said that the test in Jacksonville came about 3 or 4 weeks ago, and they didn't work, and they had to send them back. So the testing process right now in the U.S. is important to understand because I think this is going to spread like wildfire around the U.S. Is when you are getting tested, they basically test you, they take the results, and they have to send them to the CDC, and the CDC sends them back to you. It's a 48-hour process, which is insane. So if I go to the doctor and I say, "Hey, you know what? I don't feel good, and I have the symptoms. I have a fever, cough, dry cough." The first thing they ask me is, "Have you been out of the country?" And I say no. They're like, "Okay, go home," basically. And they don't know if I've been in contact with someone who has been in China or Japan, Asia, Italy, all these infected areas. So, and we're not testing for it at all, which means a lot of people have it right now and probably don't know it, which tells you that, listen, it's not serious. I spoke about this earlier in my podcasts and just in my newsletters. How this isn't a health crisis. It's not like you have to worry about catching this because the symptoms are a little bit worse than the flu. You have less than a 1%, about a 1% fatality rate. You're going to see 3.5%. That includes China, minus China because China has a terrible healthcare system. It's a lot lower than that for developed nations, around 1%. And was it 60,000 people got infected with the flu so far? So I'm expecting tens of thousands of people to get infected. Not that I'm calling that this is a crisis, but it is going to result in, what do we do? We're going to close schools, we're going to limit travel, what we're doing now. But just the fact that the testing taking place is not accurate right now is pretty insane, right? I mean, you're basically letting people, and there's stories of people telling you this, just I went in there, I had symptoms, and they said, "Hey, don't worry about it and go." And this is going to spread. From an economic perspective, it's definitely going to be a negative. It's going to be a negative longer than 6 months. I don't think that's factored into earnings yet. Earnings are trading very, very high. But look, this interview is really important. It's really cool. It's like an inside interview. It's going to take you to the front lines of exactly what happens. And even when I asked the doctor, I asked Chad when I said, should they be closing schools? He agreed with me. He said, no. He's like, if you're sick, you should be staying home. They shouldn't be closing schools, but they are going to be closing schools. Right now, there's 13 states. There's about 130 people that are currently infected in the U.S. I wouldn't be surprised if it goes into the 10,000s pretty easily. Again, not to alarm you, but that is going to have consequences for the market, consequences for the stock markets and the economy. Not just here, but also abroad, right? Because we're the largest economy in the world in the U.S. But if you want to listen to that interview, go to my Wall Street Unplugged podcast. It's absolutely free. I'm not selling anything. It's just to educate you more because this is how I'm making my decisions and how, the sources that I have that I'm going to are just leading people, sell side firms, seeing what the opinion is out there and what's going on. But, you want to get the most data as possible to come with your decisions. And that really helps when it comes to how to prepare yourself for asset allocation and stocks and things like that. But that interview is going to be on Wall Street Unplugged. It gets published right after the close today. Today's Wednesday. And if you don't go to iTunes to get it, you can go to our website, curzioresearch.com, and just there's a button there that you can listen to it. But definitely listen to that segment. Also, I'm going to break down the three things that scare the crap out of me right now in the markets that a lot of people really aren't talking about. So there's a reason why the Fed lowered rates by 50 basis points, not waiting to the meeting. I mean, they actually see a recession on the horizon. So I know you've seen an uptick today, and people are going to tell you to buy into the market, but be very, very careful here, guys. It's just limited information. There's a lot of uncertainty out there. And what we want to do is get as much data as possible. We're going to know a lot more when companies report earnings in about 2-3 months. And we'll have a better feel of what stocks we could really jump back into. But right now, don't rush. Okay, right now, stocks, Dave Rosenberg said it best as economist, that they're being rented right now. You can't own them, especially when you're seeing what bond rates are, interest rates on bonds so low. So be very, very careful out there. And I'll go back to you guys soon. Take care.